I think that having done it both ways, I think the patient experience when you do a sterile FLACS procedure is so far superior because in their mind, it's one procedure. And they're draped when you're doing the laser part, and you can give them anesthesia or you don't have to, kind of depending on surgeon comfort and preference. But I think it's more comfortable for the patient when they can't see the laser coming towards them, even though it's really not that intimidating for most patients the way we normally do it. I think when you're doing it in a sterile setting, the patient knows as soon as they're draped, they're like, oh yeah, okay, the surgery's starting. And in their mind, it's not step one, and now I'm waiting in limbo. Like, wait, was that the whole cataract? Did we do it? No, we just did the laser part. We still have to go do another step now. And so I can't tell you how many times in a given surgery day, even though we tell them, oh, we're going to do the laser part, and we do the laser, routinely patients will be like, oh, is that it? Are we done with the surgery after you do the laser? And that doesn't happen when you do it sterile because it's just all part of the same experience in their mind. The other thing that I think is better for the patient is if you have a feeder model where you're doing the laser and then you have to transport them into another room, there's a significant time gap in between the laser part, which is stressful for the patient, and then the actual phaco part, which is another stressor for the patient. And so if you can try to minimize this waiting time, I think it's just less anticipation, less stress, and that really can help reduce patient anxiety when they just start the procedure one time. They're not starting surgery twice, and I think that really helps them.